Now, this is not going to make me popular with the men, but someone needs to say this, so it's going to have to be me. Someone pointed out on my post, and quite rightly, that men are notorious for going to the doctors, and that is very true. So I'm going to talk about the P word, the prostate. Now, this is the prostate gland. This is your bladder. It sits underneath. And yes, there is an entry route via the anus. Now, let's get away from that being the only way to find out if you've got prostate problems, because it jolly well is. We have moved on. Times have moved on, okay? And there are several things that can go wrong with your prostate. So firstly, an enlarged prostate is almost part of the aging process. So by the time men are 50, probably half of them will have some form of enlarged prostate. By the time they're 80, it'll be about 90%. So enlarged prostate. Then we have prostatitis. That's inflammation, can be caused by infection and bacteria. Easily treated, antibiotics, conservative treatments. We live in a great era. Now let's get on to the big one, the big C, because this was the leading cancer in 2025 in the UK. It has risen by 25% since 2019. Now, it affects almost 60,000 men in the UK, and 10,000 men a year die. And I'm not sure if that's necessary. Now, we know with cancer, the later we leave it, the less chance, the worse the prognosis. Now, the problem with the prostate is you might not always have symptoms in the early stages. So you should just get it checked routinely. But what are the symptoms? The symptoms are usually always around urination, frequency, not being able to start, not being able to stop, any changes, sexual dysfunction, pelvic pain, blood in your pee. So you don't really want to wait till you've got symptoms. But if you do have symptoms, it doesn't mean you've got cancer. Remember, there's an abundance of things that can go wrong with this. And there's an abundance of treatments. Cancer now is what we consider a long-term condition because it grows slowly. Prostate cancer in men is often just monitored, treated with hormones to slow it down, monitored, and the prostate's only removed when it gets to a certain size, if it gets to a certain size. So you can live almost a completely normal life. So, but not if you don't know. Not if you don't know. So you shouldn't really be waiting till you get symptoms. Now, your doctor doesn't do this anymore. It's a simple blood test, and there is such an abundance of treatment. So you don't even have to put up with all these crappy symptoms you may be experiencing. That's not to mention the effect that it has on your mental health. So just do it. Just do it. Go to your doctors. Think of your families. Go to your doctors. Get it checked via a blood test or another route. There, I said it.